The bankruptcy of General Motors is probably an example of that. They had all the expenses of health care, and Toyota did not, because Japan takes care of the people.
Right.
And so they went bankrupt.
And frankly, General Motors has a better plan than we do. General Motors has a single-payer health care plan that they fund. And if you work for General Motors, you're part of the single-payer health care plan for General Motors. Folks tend to wonder what single-payer means. Here's what it means. In Vermont right now, we have a single-payer system. If you're lucky enough to be a child in Vermont, you are eligible for Dr. Dinosaur, which is we're the only state in the country that provides health insurance for all of our children, and you're eligible for a very good single-payer system if you're a child. If you're lucky enough to turn 65, you're eligible for our single-payer health care system. If you're like my dad, who fought in World War II, you're part of the Veterans Health Care System, which frankly is a socialist system. Those providers actually work for the government. It's a cost-effective, very good system. What I'm going to do as governor is take care of all the people who are left out of our current single-payer systems.
I turned 65 last year, and I got Medicare, but it's not as good as when my mother had it years ago. They paid for everything, it seemed. But now there's deductibles, and there's an extra, the prescription medicine is a big problem. And
but see, the real problem with Medicare is basically not the system itself, the Medicare system. It's the fact that it has been underfunded, and that has been an act of Congress. Essentially what they've been doing is trying to underfund it so they can kill it. Because there are many, especially those who are influenced by the industry, who basically want to get rid of Medicare. We do know this much. The real question is there enough money floating around in healthcare right now to pay for everything that people need? And the answer to that is yes. But what we have to do is spend less of it on paperwork and unnecessary administrative tasks and profit, and spend more of that on medical care, so that you wouldn't have those problems of those huge copays and deductibles that are present in Medicare. There is more than enough money. What we have to do is have a will and have everyone under a single system. That's really what is needed. There is more than enough money in the system, though.
And to give an example to what Deb just said, imagine that you're a small business person in Swanton or Enosburg or St. Albans. And like my company, you have 16, 18, 20 full-time employees. And you go out and you buy health insurance. It's going to cost you about 110, 120 grand a year, $120,000 a year. Even if you have that insurance, chances are that you do what my business does. You go to your doc or your provider. They send you leave. The insurance company sends you sometime 3 or 4 weeks later, or maybe 2 weeks later, a bill. You can't figure out whether you are supposed to pay that bill or whether the insurance company is paying it. It's usually some kind of co-pay arrangement. So what do? You wait and see whether the insurance company pays the bill, how much they pay. Then you get another bill in the mail telling you that you need to pay the bill. Then you get another bill telling you how much you're going to pay. There's often 4 or 5 or 6 pieces of paper, 4 or 5 or 6 people sending you different payment information, and finally after a number of months you get it figured out. The point is, that's costing 10 to 12 to 15 cents on every healthcare dollar. The plan that you just referred to, Medicaid, Medicare, government-run single-payer system, they pay roughly 4 cents on a dollar for administrative services. We are wasting a huge amount of money, hundreds of millions of dollars, shipping bills around in this state that should go to people like Deb Richter to make people healthier.
I lived in Quebec, Canada, for a couple of years during the 1990s. And when I compare this health system there with Medicare, it was much better there. There were no bills, right, and there were no co-pays.
Right. And I think the other thing to remember, and I deal with patients who are dealing with these terrible problems, is imagine being in the middle of dealing with trying to get better from cancer. And on top of that, having the worry of, is this bill going to be paid or not? Am I going to lose my home over this? That is really what's going on in the United States. And it's almost criminal when you consider the fact that we're spending twice as much as Canada per person. And look, and their outcomes are better. They live longer. Now, Canada does have its problems, and we don't have to replicate those problems. we can look around the world and sort of take a sampling of different types of systems throughout the world, but every other industrialized country covers everyone. And they spend on average half as much as we do. They live longer and they have better outcomes. And now we're showing actually the quality of care in these other countries is better than we're getting in the United States. It really is, it's unbelievable we've put up with it for so long.
Dr. Richter, on Friday, May 1st this year, at the Vermont State House, there was a statewide rally for health care as a human right. Would you like to tell us about that?
Well, yeah, that was organized by the Vermont Workers Center. They're spearheading a Healthcare as a Human Right campaign, along with many others. There are many other organizations that we're pushing Vermont for single payer. We were also present at the rally, and it's been very good at trying to mobilize people, around the idea that healthcare is a human right. And so I think they had close to 1,000 people show up.
Yes, I was there. I was very impressed by the large number of people. We started it off at the City Hall there in Montpelier and marched down the street, and it was almost an endless stream of people to get to the State House.
This is the second year. They had it the year before also. Very well attended. I mean, there's no doubt that I think this, the majority of people want a rational healthcare system where everyone is covered and we pay for it publicly. The majority of doctors in national polls have been shown they want a single-payer healthcare system. So the real problem right now is that the political process is not kept up with really where the public already is. And we need to start listening to the people. And if the providers are already there, I mean, what more do we need?
But the Vermont Association of Hospitals and Health Systems has opposed single payer. Why are they opposed to single payer?
Well, if you look in other countries, if you're going to control costs on an overall level, basically what you need to do is take a look at how you're allocating your resources. I mean, just like a school budget. And when you put a budget around hospitals, it means that they can't expand in areas that they're used to just expanding in right now. It means you also scrutinize other aspects of the spending. And I'd have asked, if you had a teenager and you said, well, I'm now going to put you on a budget, I mean, what do you think they're going to say? So it's understandable why hospitals might be against this. That doesn't mean, however, that the people who work in the hospitals and the patients who are served in those hospitals are against a single payer. This may mean that perhaps a hospital board and perhaps a couple of CEOs are against it. But that does not mean that the entire hospital industry is opposed to it.
Actually, Terry, I think that what we've had in Vermont is a lack of leadership, and I would be on this issue and a number of others, which is why we've lost 10,000 private sector jobs, why Vermonters are feeling so much economic pain, why those who have jobs are finding that they're working 2 or 3 or 4 or 5 and they still can't pay their bills, why those who have lost jobs can't find a new one. But because there's been a lack of gubernatorial leadership, I think it's unfair to necessarily assume that anybody is against anything. Nobody knows what it is. And so let's speak to that for a minute. We have asked Dr. William Shao from Harvard and his students to design a number of healthcare systems, but a single-payer system that will finally give Vermont legislators, healthcare providers, hospital CEOs, the ability to actually have a blueprint, like an architectural plan for the house you're building, that would show you the different options and the different possibilities. They have so far not had the benefit of that work. And as I go around and talk to hospital CEOs, which I've done a lot of lately, they don't say to me that they're opposed to anything. What they say to me is, we're scared to death. Because if we continue with the current system, we don't know if we're going to stay in business. Here's their challenge. They now have multiple payers who pay them a different amount of money for the same services provided to the patient based upon what kind of coverage that individual has. If you're in a Medicaid, Medicare system, they're being under-reimbursed. If you're in a particularly different insurance company, you may well be getting 80 cents on the dollar. On another one, you might be getting 95 cents on the dollar. On some, they're getting 40 and 35 cents on the dollar. They can't survive that way. So what I'm hearing from all providers is, let's move to a sensible system. We want to be a part of the dialogue. You include us in the dialogue, and we'll come to the table. And as governor, I'm going to say this. I don't have all the answers. We're getting the work done. We're going to sit down and look at those plans, and we're going to involve every single provider and every single hospital and every CEO in this process, and collaboratively we're going to design a system that saves us from ourselves. And when you put it that way with the hospital CEOs, it's a very different discussion, because they understand that they can't keep doing business the way they're doing it right now too. They get it. They're smart people. So lack of gubernatorial leadership, if I were them, I would say, I don't know what that is. No, I'm against it. But if you sit down and say, hey, how's it going? They say, terrible. And if you say, how's government been treating you lately? They'll say, couldn't be worse. And if you say, let's put a plan together that actually makes you stronger and that allows you to make your patients healthier, which they all want to do, they say, I'm coming to the table.